Hello again, and a very warm welcome. You're listening to Elmar's Tooth Talk. Elmar's Tooth Talk has started with some short videos as the precursor for my podcast, which will launch in hopefully a few weeks' time. Now today we're talking about a totally different topic that has nothing to do with coronavirus, except now is actually the best time to listen to this kind of information. Today we're talking about orthodontics. Orthodontics, that's the dental department for braces, and we're talking about braces for kids. So orthodontics is part of dentistry and deals with straightening of teeth. And the dentist who specializes in orthodontics is called the orthodontist. Now, we know radiant smiles with healthy Hollywood white and obviously straight teeth, that is what people nowadays aim for. That is some people's idea of beauty. And I still remember the time when my parents took me to the orthodontist and I screamed. I had tears in my eyes because I just didn't want to have teeth extracted and I didn't want any space in the jaw. Back in those days, we really screamed and cried when we had to have braces fitted. And the reason was it just looked ugly. And people knew something is not quite right with your teeth, and obviously with yourself. Then, well, that's at least what we kids often thought. Now the world is totally different today, because nowadays it's the other way around. Teenagers actually complain if they don't get their braces fitted. I mean, it still looks ugly nowadays, although you can have ceramic ones, which you don't see that much than the metal ones. But it's still, I don't think it's not cool, or whatever the word is. It's a bit like walking around with holes in your trousers or in a tracksuit and finding that cool. But hey, that's a different story. Now, according to statistics, every third child has an abnormality that is in need of orthodontic treatment, and the number of that increases. So, what is the orthodontist actually doing? Now, the goal of orthodontics is to correct misalignments of teeth and jaws, and it also aims for an ideal occlusion, which is when the top and bottom teeth meet in harmony. And this is what guarantees the optimum function of your bite. Well, at least that is the theory. Because nowadays, like decades ago, it looks like the primary goal is that it looks good. And for good looks, we sacrifice healthy teeth and have them extracted to create more space in a too small mouth. But this would only be necessary in a very few cases. And the reason is that the problem is not too big or too many teeth. The problem is too small jawbone for the teeth, a far too small mouth, an underdeveloped jaw, for a reason we will discuss in a minute. And with traditional orthodontics, the treatment consists mainly in corrective measures with fixed appliances, which they are simply symptomatic treatment. Whereas in holistic orthodontics, we do this differently. First of all, a comprehensive consultation takes place, and a holistic orthodontist does more than just check the appearance of teeth and how top and bottom teeth fit together. It's a really long appointment where the child needs to cooperate and will also look at the posture, look at how head, spine, shoulders, hips and legs align to each other. Is one leg, for example, longer than the other? Does that have to do with the bite? Is the spine strangely curved? Is one shoulder maybe higher than the other? Is the posture itself strange? So they also look at facts that influence the proper formation of the jawbone and the positioning of teeth, such as breathing, swallowing, and of course, what happened with the sisters, what was happening with the parents. They look at environmental reasons, mouth functions, body movements, the body posture. Also look into psyche, diet is a really big point, speech, diseases, and also previous accidents. And even a traumatic birth or an awkward positioning of the unborn child in the womb can facilitate a misalignment of the jaws. And similarly, an early tooth loss of a baby tooth as a result of maybe decay, for example, or an accident, also that could lead to a permanent tooth when it grows, that it's not finding its correct placement and thus resulting in jaw misalignment. Now, all these facts are considered prior to any treatment, because if you look at teeth from a holistic orthodontic point of view, it just doesn't make sense to move the teeth about if the jaws are not really in harmony with each other or not in harmony with the rest of the body. And therefore, the treatment doesn't start with ripping out healthy teeth. Tooth misalignment, they were almost unknown 200 years ago and only appeared when the so-called Western modern diet came into being, which incorporated a lot of sugar and white flour. And a pioneer in discovering that and researching that was the famous dentist and researcher Dr. Weston Price, an American man. And he published and researched extensively about these things in the early 1930s already. And what he found was that the main reason for tooth and jaw misalignment, they were due to overconsumption of, well, you probably guess, sugar and white flour. And this in turn creates acidity in the muscle, which leads the chewing muscle in the jaw to spasm. This leads then to holding the bone in such a tight grip, thus preventing the jaw to develop naturally. And Weston Price could also find exactly this in the indigenous tribes he researched, because as soon as they were in contact with the modern diet, those children developed tooth decay and jaw misalignment. And the interesting thing, as soon as they stopped this Western diet, as soon as they returned to their original diet, the next generation of children was again free from tooth and jaw misalignment and also tooth decay, also from other diseases that we only know in the Western civilization, like diabetes. And very interesting in this regard is the research from Stanislaus Pazurek. He found that during wartime, tooth decay is massively reduced, because obviously sugar and processed foods are scarce in war times. So, if teeth do not come together in harmony, the consequences can be very dramatic. Breathing, for example, will be influenced, and also sleeping patterns. Also, perceived unrelated symptoms like bedwetting, hyperactivity, ear and eye problems, headaches, leg length discrepancies, or hip problems can also be affected. So the entire oral crevice with teeth, with jaw, palate, and the tongue, they are of tremendous importance to our well-being. And this tight connection between mouth and entire body, that is already formed in the womb. So many developments are affected by that, including communication, the speech, hand-mouth coordination, the psychological processing of impressions, and all grounds functioning of life like breathing, defense, digestion, posture, movement, and metabolism. Now there's a pioneer in holistic orthodontics, and that is Professor Balthus. He was a German orthodontist and researched extensively on the topic of orthodontics in the 1950s. And a jaw misalignment, according to Professor Balthus, is not an isolated disease, but it's a trigger, a middle or an end part in a chain of malfunctions within the entire body. Balthus is also known to have said there's no case of tooth anomaly whose roots are not based in the emotional area. Now that's something we will cover probably in a podcast or in another video. And in conventional orthodontics, one tries to, by mechanical means and tooth extractions, which are mechanically, to create space in a supposedly too small jaw, and this way create a false harmony. This often results in many patients who have had their teeth extracted as children, now in their adult life complaining about pain and limitations in their jaw joints, their shoulders, and also in their spine areas, also in arms, legs, and feet. And according to another researcher and dentist, orthodontist, Dr. Hubertus von Treuenfels, German dentist, who practices holistic functional concepts for probably more than 30 years now, he says that size and form of our jaws are never random. In his view, every tooth knows not only exactly where, but also how it has to function in the jaw. So each tooth serves many purposes and therefore plays an important role in the entire system. And besides its role as chewing and cutting tools, it participates through its supportive and retaining function in all movements of your mouth, including sucking, chewing, swallowing, breathing, and speaking, and also with every mimic and gesture. So therefore, extracting teeth with a justification to create space, as it's done in conventional orthodontics, is nothing else than adding another disturbance and another disharmony to which the body then has to adapt. Furthermore, the extraction of teeth leads to a collapse of the dental arches, which means that we have a supposedly too small arch, even more so. And most of the time, the first small molar tooth, the so-called premolars, they are the ones that are extracted. And in consequence, although the teeth allegedly look all straight, they do not work really in harmony with the jaw joints and their surrounding muscles. Consequently, problems with the jaw joints can develop, and through deficient development of the dental arches then lead to retained wisdom teeth, because the wisdom teeth get stuck in the bone and haven't got enough space to make their way into their natural position. And this is also due to not having a proper diet, because as we said previously, sugar and also dairy having a detrimental effect on that. A further consequence of the deficient development of dental arches is also insufficient space for the sinuses and their ability to drain. And this could lead to an increased incidence of sinus infections, as well as increased severity in throat and ear infections. And in return, this increases the likelihood of allergies, which we see nowadays with so many patients and so many kids. There are hardly any kids that don't suffer from any kind of allergies. And even in adulthood, one can achieve dramatic improvements of sinuses and allergic reactions by just widening the dental arches. And this is especially true when the treatment is combined with osteopathic treatment. And we'll talk about osteopathic treatment in a different video or podcast, because that's a very, very important and fascinating subject. Now, every single tooth has its own function and works as part of a team with all the other teeth through their alignment with the upper and lower jaw. They determine how well the jaw joints operate, which in turn directly affects the functionality of our entire skeletal system. So in other words, just as a flat foot can have an effect on the skeletal system and influence the bite in return can influence the skeletal system. So it's not a one-way street, it's both ways, from the top to the bottom and the bottom to the top. And teeth and the TMJ, or temporomandibular joint as it's also called, are not only participating in posture and movement, they also let us feel posture and movement. In the area of the tooth root, there are receptor cells, and those receptor cells contact with each tooth. They contact with them and they get information to the nervous system, and therefore enabling, in conjunction with muscles, with ligaments and joints, a targeted and controlled movement of the jaw. Now in holistic orthodontics, it's especially this feeling and guiding part of the teeth, muscle and TMG joints that plays an important role because it guides all our movements and all our basic functioning that happens through everything what is happening in the mouth. And that includes, as I said already previously, but it's very important to realize that, is the breathing, and it comes as well with the digestion and how we speak. Now, when should the orthodontic treatment start? On average, one can say that treatment should start as early as possible to utilize fully the growth of teeth and dental arches and to stop any kind of habits such as thumb sucking or lip biting. And the orthodontic problems that children have with their permanent teeth, these problems are often exactly the same as they had with their baby teeth, only that the baby teeth were smaller and therefore the interferences, they were less visible. But in the end, it's the same problem just transferred into the adult mouth. So as a rule of thumb, for starting the treatment, we can suggest the following. From the 1st to the 8th year, habits like we just mentioned, thumb sucking, lip biting, also mouth breathing, snoring and allergic appearances, they can be treated and should be go away. From 7th to 12th years of age, the following can be treated. The overbite, which is when the upper teeth are catching too far over the lower teeth. Also the crossbite, which is when a single or multiple lower teeth are located further out than the upper teeth, or overcrowding of teeth. All those things can be treated between the 7th and the 12th year. And if the treatment can only start after the 12th year of age, that means that it starts when probably most or all of the permanent teeth are already present. Then first those already mentioned habits should be treated, then the overbite, then the crossbite and the overcrowding. Now, if there's only one thing that sticks with you from today, then it should be the following. There should not be any tooth extraction to gain space if ever possible. Tooth extraction most of the time brings more problems than it solves. So what does the holistic orthodontic treatment look like then? Well, the ground principle of holistic treatment consists of supporting both upper and lower jaw to achieve their correct size, and therefore then providing sufficient space so that each tooth can be at its natural location. Alternative to traditional orthodontic treatment, where a fixed brace is used and only the orthodontist is in charge of the treatment, a holistic treatment is a partnership. And it's a partnership between three parts. A partnership between the patient, with children also their parents, and the orthodontist. And this can be accompanied by therapists like the craniotherapist, the physiotherapist, so that each party has their own duty and their own support to the treatment. The child obviously has to wear the appliance during the recommended time and duration. The parents, they have to motivate the child to ensure that this is really done. And the orthodontist checks the progress of the treatment, gives adjustments, and so does the co-therapist, and can, for example, do a lymph drainage, cranial sacrotherapy, or similar treatments, just to treatments to support the orthodontic treatment, that all parties can cooperate and maximize the success of the treatment for the child. Now, what devices can assist with orthodontic treatment? A fascinating device, and a device that I always used starting the treatments with the children's, and it comes in different sizes that can be used for babies, children, teenagers and adults alike. That is the lip trainer. It's actually not really orthodontic device, but it is extremely useful to train all your facial muscles. And it's a in a way a myofunctional device which has the ability to strengthen the lip muscles. And already after about 2 weeks, you can notice the difference how your lip strength has improved. The lip trainer is a good appliance to get back into nose breathing, go away, so to say, then from mouth breathing, and it can also reduce snoring, increase cerebral blood flow, it activates facial expression muscles, and it coordinates movement of tongue, throat, and balances the sympathetic and parasympathetic nervous system. So that's a really good start for getting the system going, getting the muscles exercised. And the exercise with a lip trainer is done a couple of times during the day for only a few times a day, only a few minutes. The most important time is to do it when you go or just before you go to bed. And one of the most important devices then in holistic treatment itself is called Bionator. And it's an appliance made of plastic with lip cheek bow. And the Bionator lies loose in your mouth, and without any force or pressure it's lying there, but still triggering an automatic remodeling of the dental arches. And the Bionator, it can actually do much more than that, because the Bionator therapy, it encompasses the whole person in its entirety. It acts, so to say, as a facilitator between the bite and spine. It does that by mobilizing and guiding the forming forces in a very, very gentle way. So through the Bionator therapy, teeth aren't forced in a certain position by external forces, but through targeted impulses which allow the teeth to move into their natural positions. So that's totally opposite to normal orthodontic treatment. And this way, the lower jaw almost automatically comes into its correct position, as well as the tongue, which is very, very important, because the function of the tongue will be normalized. And the proper tongue function, that's the thing that enables growth of the maxilla of your upper jaw, and therefore the single tooth will naturally find its correct placement. Now, this all might sound hard to believe and a bit off course, but it really, really works. That's really the way I have started all orthodontic treatments with my young patients, and they started as early as 7 years. So the new jaw position, meaning how upper and lower teeth bite together, that results in a general relaxation of the surrounding soft tissue and an increased circulation, and as a very important part, it's also resulting in moving away from the mouth breathing to the breathing through the nose. And that is very, very important. Then sometimes the effects of the Bionator aren't sufficient. Then another device, which is called Crossart, can be used. The Crossart apparatus supports the development of the oral cavity as well as it does with single tooth movements. So Bionator and Crossart can be used for children as well as by adults. And there are many more other appliances out there used by functional orthodontics. It's just the two I mentioned are the ones I have experience with. Now, how long does an orthodontic treatment take? Well, on average, and really depending on the severity, it takes about 3 to 4 years. Some patients respond faster than others, and therefore it only takes 2 years, but it also can take longer. Now, very important for orthodontic treatment are, as I mentioned already, supporting treatments such as lymph drainage. Homeopathy can do a lot, magnetic field therapy, or any kind of manual therapy or myofunctional therapy. They can all help to give a better result. Paduan, osteopathy, they are all important parts to help with the development of the jaws and bringing the teeth in a better position. That's something you need to talk with your orthodontist, that they really look into these different approaches. So it's more than just moving teeth about, it's really about developing the entire child. So to summarize, holistic orthodontics is more than just teeth moving around or eliminating overgrowing, getting rid of retrusive occlusion, but it's the entire skeletal system to be harmonized and a natural state of balance is achieved. And with the further help of those additional therapies, the patient then feels supported, and with the improvement in posture, he becomes more confident, and their ability to adapt to environment and to challenges that life presents. So it's really a holistic, a whole body experience. And obviously there are patients where the holistic treatment has limitations and where traditional orthodontic treatments with fixed braces have to be applied. But these are really the exemptions. That can be, for example, the case when the self-healing power of the patient is not sufficient anymore, or if teeth have to be turned, or if non-fixed appliances cannot be worn, or if the patient doesn't want to take responsibility and wants their problem solved externally. That can also be the case. Holistic also means that the patient has to play his or her part during the treatment, must have the willingness to change. If they are prepared to do so, then a permanent treatment success without force or tooth extraction is really possible. And this way the patient then can show their teeth to the world. And one very important part which we haven't tapped into, I want to mention now to wrap up this topic, that is breastfeeding. Breastfeeding is where the orthodontic process actually begins, because whilst breastfeeding, the jaw develops through sucking milk out of the nipple. And this way proper breathing is also encouraged. Therefore, the breastfeeding, I would recommend you do it for 6 months. That should really be the aim for everyone. And that is to give your child a head start into the world so that it's most likely avoiding tooth extractions later on. Of course, that's not all. A very healthy diet, which means no sugar, no dairy, and no grains straight after the breastfeeding, that will provide a good fundament for a healthy child. Okay, we've come to the end of the third video of Elmar's Tooth Talk, the missing link to total health. Thanks again for watching, and I hope to see you again next week. Bye for now.